to Christine and Tanner because they put my elbow in and it feels fantastic. So good job, people. So for the adductors, what we're going to do is we have to get this top leg out of the way. Okay? So one of the things that Preston and Gabe asked, which I thought was a good point, so go ahead and line your back for me for a second. For range of motion of adduction, if the patient doesn't have a lot of adduction, what you can do is actually get one leg out of the way and then have them come over with the other leg. Okay? That works if they've got a little bit limited range of motion instead of trying to bring it across over the body. Okay? So just wanted to bring that up. Now we're going to have you lie on your side again. Thank you. So for the adductors, the top leg is not the test leg. The bottom leg is the test leg in this situation. So I'm going to hold this top leg, okay? And I'm going to keep you here. Now can you straighten your bottom leg for me? And bring it back towards me a bit. Keep your knee straight and bring it back. I want him to be in a straight line, okay? We're testing the adductors as a group. So what I want you to do, Hayden, you look stable. Go ahead and bring your bottom knee up to my hand. So bring your bottom leg up to this leg. Good, and back down. So that's his full active range of motion, okay? So now go ahead and bring that bottom leg up again. Hold it there, don't let me push it down. Oh. Okay. So why would he be getting a cramp up here? We have the balance of the pelvis, right? So, so that just talks about the connectedness of the pelvis. But so we're going to hold the leg up and we're going to push down on that bottom leg for 6 seconds. Okay? Now we'll move on. We're going to bend the bottom leg. So now when we do the adductors, the top leg is going to be our test leg. So when you're testing the hip, you're going to test the adductors of one leg and the abductors of the other leg all in the same position. So what you wouldn't want to do is switch sides every time when you're testing adductors and then abductors. Okay? So for this one, we're going to test glute min and glute med. So for glute min and med, both of them are abductors. So Hayden, what I'm going to have you do is bring your leg, I want your foot to be in line with your hip and your shoulders. It's a little bit back. There you go. And so for the full active range of motion, it's the same for those two muscles. So go ahead and, I want you to keep your leg flat compared to the floor and go ahead and bring it up as high as you can. Great, and come back down. Now compensation is going to be to try to move it forward so you can recruit some hip flexors. So I have my hand here to make sure that he doesn't roll back. Okay? So I'm here, he's already lifted up, has full active range of motion, so that would be at least a 3. Now I'm going to have you come halfway up, and I'm going to have you extend just a tidge there. There you go, really highly technical word. And then for glute min, his foot is in neutral, and I'm going to push down, hold it there. And relax. Now, he was getting a lot of quadriceps firing, and so what I needed to have done was to roll my pressure. So I had too much pressure anterior for him. It really should be a lateral pressure, okay? And so I could have rolled my hand back even further. Now, for glute med, we're going to come up, go in a little bit more extension, and rotate your toe towards the ceiling for me. Rotate it that way. There you go. Hold it there, and I'm going to resist abduction. Hold it. And do you see what his pelvis wants to do? He wants to roll back. Okay, so he's wanting to use those hip flexors. But that's going to be glute med. Is a little more extension, that lateral rotation of the foot, you're again resisting abduction. The active range of motion for both med and min is going to be the abduction range of motion. Okay? What would gravity eliminated be for the adductors or the abductors?
Supine.
Supine, right? It's going to be the snow angel again. Now, I'm going to have you go prone for me, Hayden. Your feet are off the table. Are you comfortable up top? Okay, good. So now we're going to test glute max, which is going to be a hip extensor. What else is a hip extensor? That's a 2-joint muscle.
Hamstrings.
Hamstrings. Okay, now, Jimmy, we're not going to ask you what the hamstrings do. We want to create active insufficiency of the hamstrings, and the glute max does not cross the knee, right? So what do we want to have happen at the knee to cause active insufficiency of the hamstring? Flexion, good. So we're going to flex that because now we've shortened the hamstring here, As the leg comes up, we're shortening the hamstring here. Shortening the muscle causes active insufficiency, okay? So can you hold your leg up there? There you go. Now what I'd like you to do is lift your knee up off the table as high as you can for me. Good, and back down. Any problems with that?
No.
Okay. I have my hand here because I'm monitoring to see if he's rotating to get that leg off the table. Okay, so I'm monitoring for compensations here. So he's done his full active range of motion. What if he didn't have full active range of motion? What position would I put him in? Sideline, great, great. So go ahead and lift up for me. Go ahead and hold it there. And relax, good. Okay, so that is glute max. Now, not all patients can get into a prone position like this, and so we have a modified glute max test if someone can't go prone. This is fairly common for someone who is an older adult who has that thoracic kyphosis. This may not be comfortable, but yet that may be a population of someone who's having a hard time getting in and out of a chair, so we really need to test glute max. So what I'm going to have you do, Hayden, is stand up for me. Now these tables are not a great height for a lot of people. I'm going to have you stand at the end here, facing me. So what you're going to do is lean forward and put your hands like this, your forearms, just your forearms. There you go. And bend this knee just a little bit. And what I want you to do is actually I want you to be in this position. So I want your waist resting on the table, and you're going to bend your left knee. Okay, that works. Okay, so now what I'm going to have you do is lift this, keeping your knee bent. I'm going to have you lift this leg up, back, like this. There you go. Okay, and back down. And now come back up again. And now I can push. And relax. This doesn't require that hip extension range of motion that might be limited because of hip flexion, or if they have some postural things going on with the spine, it doesn't require them to be able to get into that neutral spine posture. So this is a modified way you can test the glute max. Okay? So on the inside line, you're going to test hip adductors as a group, and then you're going to test the glute min, which is straight up abduction with the foot in neutral, just slight extension. Glute med, you're going to go into a little bit more extension, but still not a lot, and the lateral rotation. The full range of motion for both of those is hip abduction, okay? And gravity eliminated would be supine. For glute max, you're going to be in prone. You want to create active insufficiency of the hamstring by flexing the knee and then resisting extension. Gravity eliminated would be sideline, and then the modified glute max is off the side of the table. Okay? All right, you have 3